to this video. This video is about the anatomy of human lungs. Here we have dissected and taken out the right and left lungs from the cadaver. As you can see, it has a mottled appearance. The lungs can be either pinkish or greyish according to the environment the person lived in. The grey colour is usually due to the inhaled carbon particles. The right lung has 3 lobes while the left has only 2 lobes. This is the right lung. This is the left lung. This is the oblique fissure and the transverse fissure. This is the oblique fissure. By these fissures we can divide the lungs into right upper, middle and right lower lobes. The left divided into left upper and lower lobes. Now let us identify the 3 surfaces of the 2 lungs. They are the costal surface, the diaphragmatic surface, and in the anatomical position, this side faces the mediastinum, therefore that's the mediastinal surface. This is the mediastinal surface and the diaphragmatic surface of the left lung. This is the cardiac notch and the lingula of the left lung. Now let us look at the hilum of the left lung, which is in its mediastinal surface. For better understanding, let's go through the diagram first. In the hilum of both lungs, we can see 3 main structures. They are the main bronchus, the pulmonary artery and the pulmonary vein, which is divided into superior and inferior pulmonary veins. Here in the left lung hilum, in the top is the left pulmonary artery. Inferior to that is the left main bronchus. Anteriorly and inferiorly to that, we can see the left superior and left inferior pulmonary veins respectively. The extension of the visceral pleura into parietal pleura can be identified as the pulmonary ligament inferior to the lung hilum. The main grooves which we can appreciate are the groove for the aortic arch and the left subclavian artery, and the groove for the descending aorta, the groove for the first rib, groove for the esophagus, and there's a site for cardiac impression. Keep in mind that sometimes all these grooves may not be evident in the cadaveric specimen. Now let us try to identify those structures in this cadaveric specimen. This is the pulmonary artery at the top, the left main bronchus, left superior pulmonary vein, left inferior pulmonary vein, and this is the left pulmonary ligament. This is the groove for the arch of aorta and the descending thoracic aorta. Groove for the first rib. Groove for the left subclavian artery. This is the site for the cardiac impression. Now let's look at the hilum of the right lung. In the right lung, the lobe bronchus for the right upper lobe and its branch from pulmonary artery is given off before entering the lung. In right lung hilum, the right upper lobe bronchus and the right intermediate bronchus lies most posteriorly. Anterior to it is the right pulmonary artery. Further anteriorly and inferiorly, we can identify the right superior and right inferior pulmonary veins respectively. The main grooves which we can identify here are groove for the azygous vein arching over the hilum, groove for SVC and the brachiocephalic vein, groove for esophagus, and finally the site for the cardiac impression. Now let's look at the cadaveric specimen. This is the right pulmonary artery, inferior and superior pulmonary veins, and the intermediate and upper lobe bronchus in the right lung. This is the groove for the esophagus, and this is the groove for the azygous vein arching over the hilum. This is the groove for the SVC and the brachiocephalic vein. This is the site of the cardiac impression.